And apart from the new data existing in literature, and apart from the experience I gained with patients having PCDH19 and whom I do follow here in Rome, I would like to get started with systematic review published in 2018, where we look at the meta-analysis of 271 patients suffering from PCDH19, and the idea is to identify psychiatric comorbidities and the association running between the onset of seizures and the severity of the disease, which is what the Professor Vigevano this morning briefly discussed. Now, from the neuropsychiatric point of view, as far as cognitive functions, as we know, what emerges is that just like PCDH19 represents a spectrum, also the cognitive profile is equally heterogeneous. There are some patients who have a cognitive function which is absolutely normal, and there is a 17% of this group which displays a moderate delay, which is almost representing half of the patients who were looked back at and reanalyzed in the course of this work. Then another important aspect is that a cognitive disorder preceding the seizures has been described in 15% of the cases. And here in this table, as you can see, this is referring to borderline normal patients, but also what we see is the presence of a considerable number of patients having moderate, severe, deep comorbidities, which account for 44%. Now, with respect to psychiatric comorbidities, out of the 271 patients, 2,013 cases, there were some very specific psychiatric information, pieces of information, and the results were that the autistic characteristics are the prominent ones in 19% of the cases, and that the hyperactive or attention disorder cases account for 11%, and that the behavioral disorders account for 6.1%. And all of the works that have been reported in this study show that there are many psychiatric comorbidities, and amongst them, we also should include autistic aggressive disorders, hyperactivity, and obsessive compulsive disorders. And we shall see that in other studies that belong to our own experience, we will see what is the onset age of psychiatric comorbidities, as well as behavioral disorders. Now, still going back to the study, I would like to say, maybe this was already said by Professor Vigevano this morning, but there is evidence of early onset of seizures, which is correlated to an ID, an intellectual disability, which is more severe, and that the type of mutations and the early onset of seizures and the severity of the phenotypes, we could not match any significant statistical significance. So the suggestions of the authors are the following. That is to say, the association between an early onset of seizures is correlated to a severe cognitive disability together with an important behavioral disorder, and that the majority of PCDH19 patients displays a cluster of early seizures around the 19th month of life. That is when we start seeing the glucose metabolism. And whatever seems to be hampering cognitive functions, such as attention, psychiatric disorders, schizophrenia, depression, obsessive-compulsive disorders, which may be linked to the impairment of these regions belonging to the frontal lobe. This critical activity, whereby we refer to the serial onset of seizures in the early months of life, and we would like to say that there is a disarrangement of neuronal development which leads to a cognitive dysfunction. Within this framework, what I would like to stress, and maybe this could also be a topic to discuss, is the following point. There are some 30% of our patients that belong to the case numbers of Marina Trivisano and Nicola Specchio, which tend to head towards the status epilepticus, which is not only severe but also recurring in the first year of life. So our question is, may the status epilepticus be accountable for a cognitive severe disability and also accountable for the psychiatric disorders, although the onset of the two conditions takes place in different moments of their life? And that is the question. So this is something that already was mentioned by Professor Vigevano, and we could say that these patients have been split in three different categories. First, early stage with seizures, an EECG with slow activity during the cluster, and a normal evolution before seizures, then a second phase after the second year of life, so a second stage with seizures that are focal, bilateral, generalized, and the onset of an intellectual disability, together with a third stage, which comes after the first decade, which is matched to seizures that are febrile, where there is a sensitivity to fever, and a reduction of both clusters and seizures, while there is an onset of psychiatric disorders. This is the work of Nicola and Marina on the refractory status epilepticus on PCDH 19 patients. Here we see the case numbers. There are many enrolled patients, and we've said that in 30% of them we see some status epilepticus which is refractory. Now, here we see a table, and maybe Marina could be intervening now because she's the one who wrote this work, and we can see how the status epilepticus in between 2010 and 2019. This is a refractory status epilepticus, and there are many frequent cases, as you can see, and all of the states, the statuses are correlated in the majority of cases to a severe intellectual disability, to autism, and this is affecting the majority of patients. With respect to our own experience, and I work in the Bambino Gesù hospital, especially with respect to the data I just presented, and with respect to this discussion, I would like to say that I looked back at 16 patients that were followed up in Rome, and I tried to check their psychomotor development and evolution before the onset of seizures. 3 patients out of 16 had an hypotonic syndrome. 2 of them were submitted to a neurological checkup because of this reason, and 2 patients out of 16 had a delayed psychomotor development before the onset of the cluster of seizures, which was characterized by a very poor interest towards other people, surrounding objects, play activities, with some limitations, and poor motor activity. Another activity which I did check is the following. In our own experience, the one of my hospital, we could see that 3 patients out of 16 at the beginning of at the onset of the status epilepticus cluster, that is to say patients who were sent to resuscitation units, as our colleague said this morning. Well, with respect to these patients, it's not easy to understand where is the limit line or where is the dividing line between what happens and the fact that they end up in the resuscitation intensive care. And so the status epilepticus and the seizures, which were very frequent and which were considered as the onset of epilepsy, did exist in 3 patients out of 16. And the duration of the status epilepticus was included in between 7 and 13 days. And then we could also say that these patients had a cognitive and motor regression. 2 out of 16 patients had lost the ability to stay seated, whilst before they could stay seated, and had lost the ability to start saying the very few early words. Now, these patients were lost to all of these abilities and skills. Now, with respect to the treatment, the recovery was very slow, took a long time, and the deambulation, which took place after the second year of age, showed that in these patients, the cognitive disability was extremely important. As far as the follow-up is concerned, we have already said that there were some ECG abnormalities, piriform abnormalities that were affecting their intellect, were very frequent within the seizure cluster. In these patients that had exited from the status of status epilepticus, apart from the abnormalities, the piriform abnormalities, which are rare, which are not belonging to the cluster, but do exist in the follow-up. Apart from that, we should say that there are some abnormalities, delta abnormalities of broad voltage, which affect the temporal regions in an asynchronous manner, and especially the anterior temporal region is affected. So the exiting of the patient from the status epilepticus in the follow-up was entailing a severe cognitive disability and a severe autism in 2 patients, and a total absence of the ability to utter words. In the other 2 patients, as was shown and said by Dr. Vigevano, we know that these patients had important impairments, especially as far as the linguistic skill is concerned. There are no cerebellar pyramidal signs and evidences, and we do not evidence the Dravet syndrome, but the onset of the cognitive disability and of the psychiatric symptoms represents a process which is age-related. That is to say that if it is stabilized, it is possible to end up being structural in different phases of the life. But then when this disability appears again after the second year of age and life, it may stay stable. Autism in young children is preceded by hyperactivity, by attention deficit, and by aggressive behaviors. And this is what we did 2 years ago. This is the very slide that Professor Vigevano presented as regards schizophrenia, and this is showing that psychosis represents a clinical characteristic which has a late onset in the girls affected by PCDH19. They did highlight that there were some psychotic late effects with a range running from 1 to 28 years of age, and in 21% of the girls having PCDH19 having 11 years of age, and that develop some psychotic disorders. And in some 15% of them, there may also be a co-presence of schizophrenia. And if we take a look at this table, I believe that what is interesting is that in our case numbers, we could see that within a number of items that were considered, it is possible to say that these patients, all 3 of the patients, presented with a delayed psychomotor evolution and activity before the onset of seizures. They regressed at the age of 11 or 8 months of age, and in 1 out of the 3 patients, the last on the right-hand side, we saw a regression typical of the status epilepticus. Now, with respect to intellectual disability, which, as you see, is affecting especially the linguistic skills, there were also some autistic behavioral problems. And what is clear out of our case numbers, also as regards the older patients, there is a presence of an obsessive-compulsive syndrome, which is representing one of the most frequent traits in the post-adolescent age. And I believe that this seems to be one of the important traits which is correlating well with the data that were presented before. Now, I would like to say, as regards this round table, what follows. I believe that there definitely is a disease, a genetic condition, but it is also possible that the severe recurrent status epilepticus and the type of the status epilepticus may be affecting the intellectual disability and also the other psychiatric aspects, other abnormalities that do not belong to the cluster, which are slow abnormalities, slow evolving abnormalities, which persist for a number of years, which may be accountable for the severity of the typical psychiatric intellectual disability phenotype. And the patients showing and displaying a previous psychomotor delay may also be considered, maybe because this could be an important trait. And in the case of the abnormalities present in more severe patients, maybe this may be also be related to the general picture. Now, obviously, we know that this was the object of a work conducted on patients who we cannot say are having the same pictures as ours. So this is the stimulus I would like to submit and to allow to be discussed during this.